Every day, Dr. Ruthri Goodwin cares for patients in Madonna's specialized cancer rehabilitation program. It's a job she's always loved, but now she feels an even deeper connection with her patients.
Now, I had always aspired to be a compassionate doctor, to be kind, but having cancer myself definitely taught me a lot of lessons. It taught me not just to be sympathetic, but empathetic. I know what it's like to receive that diagnosis, to hear the words, "You have cancer."
Dr. Goodwin discovered a lump in her left breast in October 2022 and underwent a bilateral mastectomy.
After my surgery, what I found was I felt immense pain, especially in my left upper extremity. So kind of in my left arm, right in this region, which is where I also noticed this rope-like thick structure, like scar tissue that was just kind of anchoring my arm down, like to my body.
She was having what's called cording or axillary webbing syndrome. What happens is post-surgery of lymph nodes, we can have scar tissue buildup that then increases tightness and decreases range of motion and shoulder flexion.
I would say the most difficult thing for me is I'm a mother and I have a beautiful 11-year-old that's the love of my life. She loves to lay on my left side whenever we're watching TV, laying in the bed together, and I always put my arm around her, and I wasn't able to do that. I couldn't even have her lay on me because it was so painful.
After doing some research, Dr. Goodwin relied on the expertise of her colleagues at Madonna's TherapyPlus outpatient services. Consulting with her surgeon, occupational therapist Tyler Pribnow found therapeutic interventions that helped relieve her pain.
We just sat down and I did a couple stretches, active release technique, and we popped some of those adhesions and she just burst into tears just because she had range of motion.
And of course I went home and I was able to hug that little girl of mine and squeeze her and, kind of just put my arm around her. Now, that wasn't the end of it though, admittedly. The scar tissue kept trying to come back and there was also still limited range of motion.
Dr. Goodwin spent the next 4 months participating in outpatient therapy. With the help of occupational therapist Nicole Slusher, she continued to overcome her physical deficits while also getting an in-depth look into the therapy process.
Because of her role as a physician, she understands that rehab is a collaborative process and it's not something that just happens in the therapy walls. So she was invested, she got that. She knew she had to go home and do the exercises. She was willing to make activity adaptations, environmental modifications to help her be successful.
Now able to resume her life roles as a physician, wife, and mother, Dr. Goodwin is sharing her story as a message of hope.
I've been on the other side of it. I'm not just as a physician caring for patients, I've been a patient here. So for me, it's been very humbling. The major message I have for everybody is talk to your healthcare providers about preventative strategies, like anything that's age appropriate for cancer prevention, because early detection saves lives. It saves lives, it saved mine.